Hello, everyone. I am excited to be on today. It's a little different time, but this week's a little busy, as you've all noticed. Typically, we do this on Thursday, and that's the 4th of July. And of course, that is a day for celebrating and families and all of the above. I always joke that if you didn't realize, half of those fireworks are for me. My birthday is tomorrow, July 3rd, and my mom worked desperately to not have me on the 4th. She, obviously sometimes you don't have control over that. And 51 years ago, there was a lot less control than there is today. But she said, I don't want her born on the 4th. It's the holiday. And I've since told her, I'm like, it really doesn't matter, Mom, because everybody's gone on the 3rd too. Everybody's celebrating. And so basically I just get a lot of celebrations for my birthday every year, which is awesome. I just actually have some things to ask of you guys. If you have, I'm going to need some input. I was just on a call with the marketing team for the book. And first of all, we're working through titles and subtitles right now, trying to figure out exactly what to call the book. But really, we want to know what it is that you love about what I share here at Living Well with Dr. Michelle. What is it that I share that you like? Because we want to do more of that. And that's really what we want to focus in on is what is it? And we were tossing around some ideas and some things. And, let me know if this resonates with you at all. We were talking about how today, with this information saturated world we live in, with so much information on social platforms like this, on just everywhere, through websites, through even ChatGPT and YouTube and everywhere, there's so much information, but a lot of times that information is very surface level. It's here, take this pill. And I've fallen prey to this numerous times where I have something I'm struggling with. Like currently I'm hitting the menopause spread, the menopause middle, where there's just this stuff going on. I'm like, wait a minute, my clothes aren't fitting the same way as they used to. And so I watch this thing and I see that this pill says, well, it's going to balance your hormones and everything's going to be all better if you do it. And so I buy the pill. And then I don't really ever ask much else. So if it doesn't work, I just blame the pill. If it does work, I'm super excited, but I don't know why. So there's really no underlying base information or knowledge about why or why not these things don't work. That's what I hope to provide for you, is not necessarily big, long explanations, although the book will have some of those, but more background to why your body works the way it does, how your cells work, how every single system works, and how, if you're having something going on, you can correct those symptoms by using the elements of the earth, by using the things that the earth provides. So we don't have to buy just a whole bunch of pharmaceuticals. We can actually utilize the things that the earth has to help us become well again, or to stay well. That's even bigger. A bigger role is just to stay well. So I really want to know, am I doing that for you? Am I providing information on a deeper level, but deeper and understandable still? Because that's my huge goal, is deeper, so you can utilize the information to not just take a pill, but to know why or why not it didn't work, or, why it did work or why it didn't work, but also to modify the recommendations if necessary based on your own personal situation and the way your own body is working. And that's really what I want to do. And I'm hopeful that this book really speaks to that. So let me know, what is it that you like about what we do here? What is it that you like about what I share? Is it helpful for you? What has it done for you in your life? All those kinds of things, because that's what I want to do, is just more of that. So if you can help me, that would be awesome. Let's dive into some questions. I've got to be right at the time today. So I'm going to just dive in here. Does your tooth powder help whiten teeth that are dark from age and not stains? Let's talk about this. Why do teeth darken with age? Well, interestingly enough, the part of the tooth you see here is called the enamel. And I talk about this a lot, that it's mineral layer. And that mineral layer is white. It's actually the not see-through portion. It's the white part that you see. So the thicker the mineral layer or the enamel is, the less you see the underneath layer. Well, the underneath layer of the tooth is called dentin, and the dentin is quite yellow. That's how we as a dentist know that we've drilled through the enamel and we've gotten to the dentin, is because the color changes. The color changes, the texture of it changes, a lot of things change. So when the enamel thins over time, what happens is you see the yellow underneath through the enamel. So it looks more yellow. So when you say my teeth yellowed with age, they do, but it's not because the tooth itself has gotten yellower. It's because the tooth itself has gotten thinner and you see the yellow layer underneath. So what do? You build up the mineral white layer on the outside, which is the hydroxyapatite layer. And how do you do that? With the tooth powder. So what does the whitening tooth powder do? What does it do? And, can it help? Absolutely. It does a couple of things. First of all, it has the same amount of hydroxyapatite as all the other tooth powders do. But the other thing it has is it does have stain removers. So it has salt, baking soda, and charcoal, which are all simply there to remove stain. Charcoal actually also carries the stain out. So it absorbs things and carries it out. Those are the reasons that I added those extra ingredients to the whitening, is so that it removes stains, carries the stains out, but also then adds hydroxyapatite in. And honestly, that's how to whiten a tooth, is to make it stronger. So as your teeth get a little bit weaker, a little thinner because of age, because of diet, because of acid, whatever it might be, we need to add that all back in. So that's the key to whitening a tooth. And the darkening from age is absolutely get as much hydroxyapatite as you can in there, which is tooth powder and mouthwash both. Okay, what information? I'm sorry, I am going to have to reply to something really fast. I have a huge, so we just, if you didn't know, we have just had our warehouse. We've just moved our warehouse, and that has been a process for sure. And along with that process, we have had to, sorry, I've got to send this on. We have had to do the real deal. So we've had to get some racking, and this was just all of our racking is coming today. So big, tall racks, because so many of you are supporting us and ordering product, that we have to have a lot more in stock than we used to. So anyway, I just have to send that on. The racking is going to be here in an hour. Okay, so what information can you provide about oral prebiotic and probiotics? Let's talk a little bit about that. So first of all, what is the difference between a prebiotic and a probiotic? A prebiotic is it's an actual bacteria or yeast. There's some prebiotic yeasts as well. So it's an actual bug, if you want to think of it that way. That's what a prebiotic is. A probiotic, opposite. That's what a probiotic is. That's what a probiotic is actually the thing that we want to encourage to grow, because it helps us. They're called symbiotic microorganisms. Basically, they're bugs that live with us and they help us. They do good things for us. That's a probiotic. What's a prebiotic? It's actually the thing that the probiotic eats. So we like to have prebiotics and probiotics. Here's the cool thing. I've got something I need to tell you. So in the toothpaste that's going to be coming out, and believe me, I'm working hard to get this done quickly. In the toothpaste, we're going to have something we call like an optibiotic even, because what it does is it actually feeds good bacteria and it kills bad bacteria. So it does all of these things, because a probiotic, all it's doing is giving you a whole bunch of good bacteria to compete with the bad bugs, but it's not necessarily killing the bad bugs. The prebiotic could be feeding all of the bugs. So what we want is something that the bad bugs can't eat, but the good bugs can flourish with. So what do I think about these oral probiotics and prebiotics? I think they're great if you have an issue with gum disease primarily. So probiotics, prebiotics are good for gum disease treatment. They will help manage the bacteria in your mouth and balance the bacteria in your mouth. Is that a good thing? It is. If you have staining that's colored, so if you have orange, yellow, green, black staining on your teeth, you've got a probiotic problem. You have the bugs in your mouth are out of balance, so you need to be using some sort of an oral probiotic. Now, what one do I recommend? Honestly, they're all very similar, and they all use very similar strains. So what we do is, so you're going to use that, but then when the toothpaste comes, you're going to use that, and it is going to help to kill the bad bugs, strengthen the good bugs. It also helps with gut biome, so it's going to help that way as well. So super great. At the moment, an oral probiotic, I don't really have a strong recommendation. They're all really pretty dang good if you have staining or gum disease. Those are the two reasons. Okay, thank you. Somebody said, love that answer to our questions. My appointment with you isn't until September. So the more information I get in the meantime, the more informed I am. Absolutely love that you're focused on the root. Okay. So really that's the basis here of what is beneficial, hopefully. And hopefully there's other things as well, but yes, root cause and helping you to understand root cause so that you can then utilize that information. My analogy is usually cooking. So if you always follow a recipe, and if you follow a recipe strictly, meaning you never color outside of the lines with a recipe, you can cook a recipe, but you actually don't know how to cook necessarily, if that makes sense. You know how to cook. I may be saying this improperly, but it's even more powerful if, let's say, you learn how to properly saute something. So then when you see sauteing in a recipe, you can say, actually, I'm going to change that up a little. You're able to utilize the recipe. So if you understand root cause of health and the way your body works and the way your cells work, then you're able to cook. You're able to make your own recipes. You're able to modify recipes because you understand how they work rather than having to just follow a cookbook pattern or, the thing that the Facebook influencer told you to take and you just buy it because hopefully it worked. You understand why does it work or why did it not and how can I make it work even better? So that's really root cause piece. Thank you for sharing that. When you pull a root canal tooth and replace it with ceramic, what about the metal post? How does that react to your body? So the great news is when you do a ceramic dental implant, there is no metal post. Everything top to bottom is ceramic. So the portion that goes in the bone, which is the dental implant that people often say, oh yeah, I have a dental implant, the whole thing here. No, the whole thing is not the dental implant. The dental implant is the portion that actually goes in the bone. It's the root replacement. So with the ceramic dental implant, the root replacement itself is ceramic as well, as is the connector piece, as is the crown that goes on top. So there is no metal in that whatsoever. I talked to a myofunctional therapist and they don't like the removable mRNA DNA expanders. What are some disadvantages compared to surgery? Okay, great question. Let's get to what does this thing even mean? What are the things that you're talking about even mean? So a removable mRNA or DNA expander, what that is it's simply an appliance that you wear inside of the mouth. And what it does is it helps to move literally the bones on the inside of your jaw here. It puts pressure, but episodic pressure, meaning it's on, it's off, it's on, it's off, it's on, it's off, which creates bone growth. So the bone actually grows out this way and spreads. Literally, it spreads or expands the roof of your mouth. It does tip the teeth somewhat also, but keeps the teeth in the bone, which is really important also. This is a big problem with orthodontics is when they actually tip the teeth out and they push it right out of the bone. And then you have gum recession, you have all sorts of issues. We don't do that. We move the teeth with the bone. So I, first of all, don't know why they have a problem with an mRNA or DNA expander. That would be my first question. I'm happy to talk with anyone about that. Sometimes they've been told that, but they don't actually know why. And again, they're just parroting back what they've been told rather than even having a very good explanation themselves for why they don't like it. So I'd ask why. Why don't you like those? Let's talk about it. Compared to surgery. Well, surgery is a huge big deal. Surgery is going to, what they do, let's just talk about it. What do they do when they do jaw surgery? They actually cut, if you feel above, like kind of underneath your lip here, you can feel above your roots, right? You can feel above the tooth roots. You can see there's kind of a depression up there above the roots. What they do is they actually saw that all off, all the way across there, and they move that down or forward, wherever it needs to go, and then they use screws and plates to hold it in that new position. Those screws and plates stay forever. So first of all, can you see a problem here? That's the top jaw. The bottom jaw, what do? They actually they cut the jaw right here and they move it forward or back, one or the other. And then they use screws and plates to hold it in that new position. Those screws and plates stay in forever. So why are these issues? Why is this problematic? There's also another surgery where they put screws in the roof of the mouth and they anchor a retainer or a expander to the screws. And then you move it out like this with screws. That may be the surgery they're talking about. All of those things require implanting metal into your body. That's why I like the removable piece. You're taking it out. You're taking it in and out. I also like the on-off. Typically, the body responds very well to on-off pressure. So you put it on, you put it off. This is why when you're exercising, you don't do the exact same workout every single day in a row. Why? Because the body needs recovery time in between. It has that pressure. It recovers. Pressure recovers. Pressure recovers. That's why we like the removable appliance, because we're putting on pressure, off pressure, on pressure, off pressure. And this allows the body to actually respond to that pressure. So I love the removable version of it. I would ask them first, why? Why do they have issues with it? I don't love surgery because you're implanting a metal thing in your body and you can't do this on-off pressure. Sometimes we have to do surgery. Sometimes there's no other option if you really want to achieve a certain outcome. But if possible, I like to do it with removable. Is there anything a person with a suspected cavitation, can't remember the fancy name, do until they get it checked, fixed to mitigate the symptoms in the meantime? Okay, so what they're talking about, this question is talking about, is if there is an area in the jawbone that is infected because an area where a tooth was removed didn't heal properly. What can you do in the meantime? We actually have a homeopathic antibiotic that we have at the office that I love called Notisan. You can take that, but you can also use a lot of antimicrobials, and that's what I would do. I would do antimicrobials and I would do immune stimulants. So what are some of those things? Echinacea, elderberry, oregano. So echinacea, elderberry are immune stimulants. Echinacea, elderberry, oregano. That is an immune, oregano, garlic. Those are all basically, they're going to be like an antibiotic. You want to do those things just on a consistent basis to give your body what it needs. I would also support your adrenals because a lot of times adrenal problems, fatigue issues are what this is showing up as. So I would do that as well as an herbal anti-inflammatory. And we have a really nice one called Inflammasol, but there's lots of others as well that are herbal anti-inflammatories. So I would do echinacea, elderberry, oregano, garlic, and an herbal anti-inflammatory to keep things in check if you can. Can periodontal disease be caused by mouth breathing? Absolutely. The reason periodontal disease can be caused by mouth breathing is because saliva in your mouth helps to move things in your mouth. It also helps to kill bugs. So if you have a really dry mouth, things are going to thrive. And so you get really red gums. That's often a sign of mouth breathing is really red gums. In fact, it's interesting. My husband, as soon as he started mouth taping at night, his gums got exponentially better. Are you familiar with hemifacial spasms and had any experience with treating that? I've not, but hemifacial spasm sounds like it's portion of your face is spasming and experience treating that. I would 100% start with an upper cervical chiropractor. I would see what is going on here. And then I would look at the jaw joint and see if you've got some impingement here happening with the nerves and if that's affecting the muscles and nerves in the face. What does a holistic dentist need to wait? Why does a holistic dentist need to wait 4 months before placing a ceramic implant? Okay, great question. Let's talk about this. So when a tooth is removed, there is think about when a tooth is removed. First of all, there's a hole, right? And it's the size of the tooth root. So if it's a molar that we're removing, there's typically 3 roots on that. The hole is sizable. Well, a dental implant that's placed in there is much smaller than the root that was removed. So think about a screw in a board. Well, if you have a hole that was, already had a great big giant screw in it, and you're wanting to put a smaller screw in that, is it going to stay? No, of course not. There's no wood to engage the screw. It's not going to stay. So what do other dentists do in this situation? They typically drill other directions. So they'll go closer to the roof of the mouth. They'll go closer to the cheek side, or they'll go higher, either towards the sinus or towards the nerve. Well, we prefer not to do that. We'd like to keep it kind of right where that tooth originally was. Or they'll use a little bit wider one. We have limits on how wide we can go with the ceramic dental implant. So what needs to happen first is that hole just needs to fill in with bone. So that's why we wait those 4 months. Is you got a great big hole, you got a smaller screw. We need that hole to filled in so that the screw can engage to the bone. That's why we wait. It's typically just to allow more bone there. And interestingly enough, ceramic implants have a harder time integrating at first or growing to the bone at first. Then they're much better in the long run. But titanium dental implants, for whatever reason, the bone will grab onto them at first, and then it kind of rejects it and pulls away some at the end. But ceramic dental implants take a little more care and finesse at the beginning to have them work. I wanted to know if I have a titanium implant that isn't causing issues. Should I take it out and replace it with zirconia? I know zirconia is better. A titanium implant, I have one myself. This one right here is a titanium implant because it was placed, I don't even know how long now, 25 years ago or more. That was all we had options there. Could it be creating symptoms or leading to symptoms? Very well could be. You have to decide that on your own. How does your body feel? There is something called a Biocomps lab test. You can look it up online, Biocomps lab, and they can test for a sensitivity to titanium. And that may be the place to start before you go and remove a dental implant, because it's actually pretty traumatic to the bone to remove a dental implant. A dental implant that's integrated, that's fused to the bone. It's a lot of work to get it out of there. What kind of water pick do I recommend? So I love one that you're going to use. That's my rule of thumb. One that you're going to use. I love a water flosser that's in a shower because you don't have to get anything out. Honestly, just using it is usually the problem with the water pick. Nobody uses it. Nobody wants to get it out. It's messy. There's no room on the countertop, whatever it might be. So if you don't have a very large countertop, use one that's a small, that's actually in the handle. Water Pick brand is the brand that we like, the actual brand called Water Pick. There's one that has the water just in the handle itself. You have to refill it a couple of times because it can't hold much. There's one that sits on the counter that's called, I believe, Omni or Odyssey, something like that. It's a really nice one as well. That one, if you have room for it, use it. But if you're not going to pull something out and use it, use the one that hooks up to your shower called a water flosser. You can find it on Amazon. It's whatever you're going to use. What type of mouth tape do I recommend? Everybody always asks me this, and I need to ask my husband because it's the one he uses all the time. It's just a real light tape. He uses this kind of like a light sport tape is all he uses on his mouth. You don't need the real stiff, thick kinds usually because you need to be able to, get a little air around it if you can't breathe through your nose very well. What about nerve pain in the upper mouth? If you have nerve pain in the upper mouth, it could be tooth pain, which might be just simply you've got a root exposed here and you need to get some hydroxyapatite in that with the mouthwash and the tooth powder. It might be that you've got something going on, an infection somewhere that's causing that. And it may be an alignment issue. And maybe you need to go all the way back to the neck and find out what's happening there. So it's a CT scan to start with. Cone beam CT scan to figure out what's happening. Is it safe to mouth tape if you have constant congestion from allergies? So it's always safe to mouth tape if you use a light tape because you're going to be able to breathe past it. So you're never going to suffocate. And your body's honestly not going to let you suffocate. If you're suffocating, you're going to rip that stuff off in the night. You're going to wake up. You're going to do whatever it takes. So it is safe because you can breathe past it. But you got to figure out what's going on with the allergy piece. Check out NAET, N-A-E-T, and see if you can get some relief there. I'm always stuffed up morning and night and have a really hard time breathing through my nose unless I really concentrate it. My airway is large, no issue. Sometimes I have allergy symptoms. How do I make sure I nose breathe? Well, this is a challenge, and it may be that your airway's fine back here, but your mouth is not big enough, which means your nose is not big enough. So it might be that those nasal passages just aren't even big enough. One way to test this is to breathe through your nose and then lift up right here on your cheekbones and kind of pull them outward and then breathe and see. Mine's exponentially easier when I do that. Is it easier when those nose and nasal passages are bigger? If so, we may need to do an expander to make more space in your mouth so you can breathe clearer. Any recommendations for finding a like-minded dentist in different parts of the country? Absolutely. We have a dentist finder on our website. Go to livingwellwithdrmichelle.com. There's a dentist finder, and it will guide you to people. I've got somebody in Southern California, by the way, a couple of them. So look on there and see. Is surgical revision good? I had an infection, 2 cysts, 2 root canal treatments, re-endo, then pulled out teeth, and nothing helped. Bone inflammation, infection, and pain. I'm sorry. That means that you probably need some surgical revision of bone being regenerated. It is good if you find somebody that can do a great job of that. Okay, a couple others here. Are metal crowns and space maintainers safe for baby teeth, especially if you can't afford anything else? Yes, they are. This is a tricky one. These space maintainers and metal crowns are going to be made of stainless steel. So it's a lot different than talking about a mercury filling. And on baby teeth, they're going to be coming out. So I find it's more important to hold that space open and prevent issues in the future than worry about metal versus porcelain right now on a tooth that's going to be removed. So that's an okay choice. I had a cone beam scan yesterday and have a cyst under what I guessed is a failed root canal. Doc says it's causing erosion to my bone. I will be having an extraction. Good job. Absolutely no symptoms and no leaking, but I assume this is my best option, correct? Correct. That is your absolute best option. Good job getting the cone beam CT scan. You are the exact reason why we tell people to do it, because you didn't have any symptoms. You didn't have any leaking. You had no idea what was going on, but that is affecting your health guaranteed. I have a small shadow or cavity, no sensitivity or issues. Also, it hasn't gotten bigger. Should we have it taken care of if it's not growing or giving any problem? If it's just a small cavity, the answer is no. If it's not growing, especially, you may have remineralized that. Keep remineralizing it. So keep using the tooth powder, the mouthwash, and make sure you're getting minerals into that area. And if it never spreads, you may never have to treat that. I have a bruised feeling above one of my teeth. Assume it's the nerve. Sometimes the nerve gets irritated and I have throbbing pain. No infection directed on an x-ray, and I haven't had a root canal, although I have a filling there. So sometimes if it's bruised above it, sometimes it's that filling is a little too tall. So when you're chewing on it, you're running into it just a little bit. Have that filling checked and make sure it's not too tall. I would also check the gum around that. Sometimes there's some gum or bone infection, and that's causing that bruised feeling, because gum infection often will show up as something like, people explain it as a achy, throbby, bruised kind of feeling more than sharp shooting pain. So I would have gums checked. You may have gum disease around that tooth and not even know it. Is there a way to stop or reverse gum recession? So the answer is yes, you can stop it. You must figure out what the cause of that gum recession is. Most people will say, oh, it's because you're brushing your teeth too hard. Well, that's actually the last reason I will point to. The first thing we look at is gum disease. Is there infection in the gum that's causing the gum to shrink away from the tooth? Is there tartar on the tooth, something that's really irritating that gum? That's the first up. If it's not that, then we say, okay, is it the way the teeth are hitting? If they are hitting in a way that flexes the tooth like this, the gum will move up away from that flex point. So you need to find out, is this a flex problem on here? And is that the issue that needs to be dealt with? If so, it's time to talk to an orthodontist about the way these teeth hit and fit together. There's no way to reverse it, but you can do gum grafting to actually rebuild the gum if necessary, but figure out the reason why first. Had the craziest experience. This weekend. I was selling something on an online classifieds, and the guy, I just happened to casually mention I was a dentist, and he said, oh, do you mind give me some free advice? And he said, I saw a dentist and he wants me to do veneers and caps all on these teeth. They're so worn out. And, what do you think? And I said, well, I think you have sleep apnea. And he goes, how do you know that? Like, how did you know I have CPAP? I said, because that's how you ruined your teeth, was because you can't breathe and you're bringing your bottom jaw forward. And he's like, yeah, I can't hardly wear that CPAP. I said, then do not do crowns. Do not do veneers, because you're going to break them and chip them just like you've done your teeth. The first step is to figure out, how can you fix the apnea issue? Then you fix the teeth. You don't fix the teeth first. You're just going to continue breaking them. So that's the way I'm talking about here. Don't do a gum graft until you figure out, why do you have the gum recession? Because it will just recede as well. Figure out root cause first. Why do some natural toothpastes avoid hydroxyapatite? Well, I believe why they avoid it is because it hasn't really been readily available, even to manufacturers, for a long time. This has just been kind of a new surge in the last few years. So I think that all natural toothpaste companies, if you watch them the next few years, are all going to have a hydroxyapatite offering. Is releasing tongue tie an alternative to expander, since tongue would do the job naturally? Perhaps. It depends on how old you are. If you're 40, no. Your tongue is not going to do the job naturally. If you're 6, perhaps. Let's see what the tongue will do. So it's all based on age. What should I pay attention to choose a good dentist? So if you go on our website, we have some information about that, about the questions you should ask a dentist. So go on the Total Care Dental website, totalcaredental.com. Lots of information there. I just had a root canal extraction. I want to have a zirconia implant. Do I need a bone graft for the implant? That's a 100% personal question. I don't know the answer, because I don't know how much bone you have, and I don't know how much bone you lost due to the reason you had, the root canal removed. So you have to have a cone beam CT scan to see how much bone is there to determine whether you're going to need a graft to be able to do an implant. With very bad enamel, which of your toothpaste should I use? You know what? I would start with the remineralizing one. The remineralizing one is great for building teeth, but they all have the remineralizing ingredients in them. So if you want to whiten, use the whitening one as well. If you're sensitive, use the sensitive. Honestly, they're all the same thing, and they all work great for that. When do you have your lives? I want to watch them always. Thank you. I'm so glad you're on here. We usually do these on Thursdays at 11 a.m. So check us out Thursdays at 11 a.m. This week we didn't do it because it was July 4th. Dentist says my crown doesn't have enough tooth left to stay on. It has had a root canal. He wants me to do an implant. Is ceramic the way to go? Should I request surgery to be done any certain way for health? This is a longer question than I have time to answer, but I'm going to try to give you a short answer for this question. If the crown does not have enough tooth to hold on to, then you definitely need to have that tooth removed and an implant placed. Absolutely. I would love for you to get a ceramic implant if possible. And when having that tooth removed, you need to ask for ozone to be done and stem cells to be placed so that it will heal properly. All right, I am going to jump on this one right off on that last question, because I have an appointment right now. Thank you so much for being on here. Have a fabulous holiday weekend. Enjoy time with family, with friends, whatever you're doing. Get out of nature, enjoy some sunshine, and we'll be back on here. Actually, it's next Tuesday again. So next Tuesday, I'll be doing the live also. So watch for info, but I believe it's next Tuesday at 11 a.m. See you all then.